Good morning. You're listening to Complete Health with Dr. Mike Rogers. Over the last several weeks, the team at Complete Health Dentistry of Northeast PA has been gathering dozens and dozens of contestants for the New Year Healthy You Transformation Contest. As of 2 nights ago, the list of contestants had been whittled down to 5 finalists. We all gathered at Complete Health Dentistry, and we met the contestants. We also spent some time speaking with all the sponsors. Let's listen in. Hi, I'm Adam Owens. I'm here at Complete Health Dentistry of Northeast Pennsylvania with Dr. Mike Rogers.
Hi.
Mike, how are you?
Good, Adam, and yourself?
Very good. We've been really excited to be running the New Year Healthy You Transformation Contest for several weeks now, and the goal is
to join medicine and dentistry and all forms of healthcare together to show how we can help improve people's lives.
And we're going to choose one lucky winner here tonight who's going to receive a 6-month complete health transformation under the care of a team of Pennsylvania-based professionals, all of whom, or most of whom, are here tonight at the office. Is that right?
Correct.
Additionally, here tonight are our 5 final contestants for the contest. Now, dozens and dozens of people submitted applications for this. You've whittled it down to 5, Mike.
We've whittled it down to 5, exactly.
They're all here tonight. We're going to meet all 5 of them, and then they're all 5 going to chat with the sponsors who are here this evening. Before we introduce you to the contestants, we're going to talk about the sponsors. Now, Mike, how many folks are participating in this as sponsors?
We've got five sponsors, our office, then we've got Apple Day Spa, we've got Lynn's Healing Zone, and we've got Cole's Fitness and Aerobics.
Excellent.
And then Dr. Charles Whitney. He's going to be the medical advisor.
Now, Dr. Whitney's not here tonight. Can you tell us a little bit about what Dr. Whitney does and what he can bring to the winner of this contest?
What he does is he looks at the total body as through inflammation and what inflammation does to a body. And so he looks for Alzheimer's, dementia, heart attack, stroke, diabetes, all of this, and how he can help reverse those issues in a family history and even in a person.
So he'll be working directly with the winner of this contest,
Correct.
As well as the other 4 sponsors, one of whom is with you, Complete Health Dentistry of Northeast Pennsylvania. What are you going to offer the winner of this contest?
Well, what our goal is, one, to get our mouth, the contestant's mouth completely healthy. Mm-hmm. And if they get an extreme makeover in the boot, then that's what we get for them. But our goal here, just like we've talked about through our whole radio show, is how the mouth contributes to the rest of the health of the body. And so if we can control that infection or that bacteria in the mouth, it can help cascade to making other systems work better.
So the thing about this entire sort of contest is that it's approaching a person's health from really so many different angles and sides at once, with the goal of being a complete health transformation. It's not just a pretty smile or a haircut. Let's go on to meet some of our other sponsors here this evening. I'd like you to introduce yourself and tell us a little about your business.
Hi, my name is Beth Marks, and I'm from Cole's Aerobic and Fitness.
Well, hi, Beth. Where's Cole's located?
It is down by the Ford dealership on Route 6.
And what's your, what are, at Cole's Fitness, if I were just a normal person to come in and ask what you had to offer, what's available at Cole's Fitness for me?
We have everything available. We have over 17,000 square feet. We have saunas. We have a walking running track, which a lot of people use because in the winter they can't get out because of the ice and the snow, where they can come out and walk. And we have personal trainers to help people get back in shape, get, feeling better. Yeah. We've had people that have gotten off of heart medication, actually even diabetes medication, just from coming and moving around and being active.
Well, it sounds like an excellent resource. What's your hope for the winner of this contest?
I would like to give them security and within themselves, self-confidence, being able to feel better about themselves, being healthy, being able to move and being able to pick things up and to move and to feel good.
Well, good. I think there's a lot that Cole's has to offer. So thank you very much for being a sponsor, and thanks for coming tonight. Let's move on and meet some other sponsors here this evening. Good evening, and thank you for joining us.
Thanks.
Would you please introduce yourself?
My name is Lynn Wright. I'm with Lynn's Healing Zone. I'm the owner. This is Hannah Haig.
Hi, Hannah. Come on in.
Hello. Hannah is our light therapist, and we offer a lot of modalities: nutritional microscopy, bioterrain auditing.
I'm not totally familiar with this stuff, so I'm sure there's a lot to it.
Yes.
And if someone has questions, they can call, make an appointment, or just walk in.
They can call and make an appointment. Everything we do is by appointment only.
Good to know.
We have a website, lynshealingzone.com. All the information and what we offer is there, along with prices. And like I said, Hannah does the light therapy, which is good for
Well, it's good for inflammation, helps with skin disorders, helps with SAD, seasonal affective disorder.
Okay.
Can be used on children, animals. We treat animals as well.
So what's the hope for the winner of this contest? How do you see them at the end of the 6-month process?
Our biggest goal is to empower people, educate them, and let them know that they have much more control over their health than they are usually led to believe.
That's good to know. All right, well, let's continue on and meet some more of our sponsors. Thank you very much, both of you. Good evening. How are you?
How are you?
Nice to see you. For our viewers, would you introduce yourself, please?
Sure, absolutely. My name is Karen Hausschultz, and I am from Apple Day Spa and Hair Restoration Salon on Route 6 in Honesdale. With me today, I have one of my bodywork therapists, Jessica Juckett.
Hi, Jessica. Tell us about what's available at Apple Day Spa.
Okay, so at Apple Day Spa, we are a full-service salon and spa, unisex for full families as well. We also have so it's hair, skin, nails, body, and we are based on a wellness philosophy. So many people think that a salon and spa is just a relaxation and pamper type experience, and it's totally not the platform that we sit on. So we're education-based, and we continue to educate. We have top-of-the-line equipment. We work with microcurrent technology. We have an infrared sauna. We work with the hydrofacial machine. We also have body microcurrent as well. So lots of...
Pretty extraordinary menu.
Absolutely. And we work also in pain management and wellness all the way around. So we're a full salon and spa with complete health.
No, and I'll ask you the same question that I've asked all the other sponsors: is how, at the end of the 6 months of this complete health transformation, what's your best hope for the winner of this contest?
Okay, so we're super excited for all the contestants because we're hoping, of course, that they are, even though they may or may not be the winner, that they are going to transform themselves and motivate themselves and move forward in their wellness plan. For the winner themselves, of course, like everyone else said, to empower them, to help them feel better about themselves. Even a little bit more importantly is that they will be an advocate for the rest of the people in our area. And I think the thing that Mike and April have brought to the table is that we have local businesses here. I'm a huge supporter of local business. So we have local businesses here. Everybody feels like they have to go to a city or have to go someplace else, or maybe these resources aren't available for them locally. And for me, it's educating the people and letting them know that there are amazing local resources for people to reach out to in order to get themselves well or put themselves in a better position than what they currently are.
Right here in our backyard.
Exactly.
Yeah.
That's
Karen,
a big deal.
Thank you very much.
Super. Thank you.
So we've gathered 5 contestants here this evening, drawn from dozens and dozens who submitted applications for the New Year Healthy You transformation. 5 of them are here. Let's meet our contestants now. Good evening. Tell us your name, where you're from.
Bob Rainforth, and I live in Fell Township.
All right, Bob. So what moved you to sign up for this and to go to dive into this head first?
Well, my mom, in her deathbed September 21st last year, she made me promise not to do to my wife what my dad did to her. And so I promised her, and I went on an aggressive keto, intermittent fasting. So I've lost 80 pounds since the first week in October. And I just heard over the radio your show the past couple weekends, and I was just like, I almost really hurt myself because I had no carbs that it was pulling the calcium out of my hips. So I almost crippled myself.
Wow.
So I really don't know what I'm doing. And when I heard you guys, it's just like, I need some guidance.
I need the help. Okay.
Plus, my DOT card, if I don't pass and lose all this weight, I'm not going to be able to drive a truck no more.
Well, good luck, Bob. Okay, we're hoping for you. Good evening. Would you introduce yourself?
Yes, Michelle Echeverria.
Hi, Michelle. It's so nice to have you here tonight. Can you tell me where you're from?
I live in Greeley.
Okay, and you heard about the contest, and what's moved you to enter here?
I'm a 2-time cancer survivor, and my mom is also. She's going to be 98.
Wow.
So I want to be like her. I want to have that longevity. I want to, do the best I can do. And seeing her every day, she gets up and does her physical therapy. She does what she needs to do to keep going. Yeah. And hearing about this was like, this brings in every aspect, like the best of all worlds, to have somebody there to support you and guide you and show you the way. So I thought it was awesome. So
cool. Thank you, Michelle. Good luck.
Thank you.
All right, we'll move down the line. Would you introduce yourself, please?
Hi, I'm Elsie Phillip. I'm from Beach Lake.
Hi, Elsie. And what moved you to enter this contest?
Well, it sounded really exciting, and like a lot of good businesses were involved, and resources available to help with my goals.
It really is a whole team that would be working
Yes.
with you, and that seems like a really good thing to have.
Yes.
All right, we'll move down the line. Good evening. Hi.
Hi.
Would you introduce yourself, please?
Christine Lewis.
Hi, Christine. Where are you from?
Cherry Ridge.
Cherry Ridge. Okay, right down the road here.
Yeah, not too far.
Christine, what had moved you to enter the contest?
Well, I heard about the contest, and I'm feeling pretty good mentally, but I want physically to match.
Got it.
And I'm going to be a new grandma soon,
Congratulations.
so I'm kind of excited about that. I want to be around for it, so I figured this was the best way to do it. We have great businesses involved.
Yeah.
Everyone's local, and it's going to be fun.
Christine, good luck.
Thanks.
And hi, you're Courtney?
Yes, Courtney Swenson.
Hi, Courtney. Where are you from?
I'm from the Waymart area.
And Courtney, you heard about this on the radio?
I did. I actually have 2 young boys, and I hope that, promoting my health will allow me to be around for a long time and to play with them and just to have all-around good health.
Wow, great. Well, Courtney, Christine, Elsie, everybody, congratulations for being here tonight. Thank you for coming out. Next, all of these contestants will be chatting with all of the sponsors who are here this evening. And at the end of that process, one of them will be chosen as the winner of the New Year Healthy You transformation.
We were so grateful and fortunate to meet all 5 finalists on Thursday night. Stay tuned until the end of this show when we reveal the winner of the New Year Healthy You transformation contest.
Do you snore? Do you wake up tired? These are signs of sleep apnea. Obstructive sleep apnea afflicts 1 in every 5 Americans. This can lead to stroke, stress on the heart, and even sudden death. Did you know that dentists can treat sleep apnea? Hi, I'm April at Complete Health Dentistry of Northeastern PA. Dr. Rogers uses oral appliance therapy to help patients manage their snoring and sleep apnea. Oral appliances resemble a sports mouth guard, and they are an effective alternative treatment to the CPAP machine and mask that is traditionally prescribed. Our patients prefer oral appliances because they're comfortable, easy to wear, quiet, portable, and easy to care for. If you have been diagnosed with sleep apnea by your physician but are unable to wear a CPAP, give us a call to discuss alternatives for you. 253-5000.
Complete Health Dentistry, transforming your health for a lifetime.
Welcome back to Complete Health with Dr. Mike Rogers. Dr. Rogers, tomorrow starts National Sleep Awareness Week. I know you're very passionate about this topic and how it relates to dental health. Can you begin with explaining what sleep does for our bodies or why sleep is so important?
Well, yes, sleep restores. It increases energy, improves immune systems, improves memory and concentration, regulates hormones such as growth, hunger, and weight gain issues, enhances moods, reduces the effects of stress, inhibits pain.
What is sleep apnea?
Well, sleep apnea is defined as when one stops breathing for a minimum of 10 seconds at a time or takes less than 25% of a normal breath. It's estimated in the U.S. that 17 to 20% of adults have sleep apnea, and that means that 15 million Americans have sleep disordered breathing, and about 90% are undiagnosed, making it more common than diabetes or asthma, and is associated with about 4% of car crashes.
Wow, that's staggering. Does snoring mean that I have sleep apnea?
Not necessarily, but it's a symptom of sleep apnea, and you should be checked out to see if you have sleep apnea.
And how do I know if I have it? What are the symptoms?
Well, one of the biggest red flags for it is if someone tells you you've stopped breathing. Other symptoms include daytime...
You mean someone tells you they stop breathing while you sleep?
Yes, exactly. Daytime sleepiness, or if you wake up tired after sleeping all night is another symptom.
So if you go to bed tired and wake up tired, that's a symptom.
Correct. Chronic fatigue can be a part. Acid reflux, snoring, restless sleep, nighttime teeth grinding, night terrors, bedwetting, narcolepsy, restless leg syndrome. Also, other warning signals or signs are obesity, people with a BMI over 30, people with large necks greater than 15 inches in circumference, elevated blood pressures, your age. The older you are, the more susceptible to sleep apnea you become. Enlarged tonsils, large tongue, morning headaches, irritability, depression, learning and memory difficulties, sexual dysfunction, and even gender plays a part. Men are 3 times more likely to develop sleep apnea than women.
Sorry about that, guys. Doctor, are all people with sleep apnea overweight?
No, they don't, but a significant population is the overweight population that exhibit these signs.
But you don't necessarily have to be overweight to have
Correct.
sleep apnea. Okay. Are there dental signs that you look for to determine sleep apnea?
Well, in my office, I look at multiple things. A deep bite, meaning your teeth are overclosed, narrow arches, constricted arches, high roof vaulted palates can be all things, missing back teeth, large scalloped tongues, open mouth posture, a long face, and even a forward head posture.
Is there a test to determine if I have sleep apnea? And if so, can it determine the severity of it?
There are 2 screening exams we do in our office. One is called the Stop Bang, and the other is the Epworth Sleep Questionnaire. And these questions are designed to figure out how likely you are to doze or fall asleep under certain situations. But the only true way to determine if you have sleep apnea is to have a sleep study done called a polysomnogram, or PSG. And there are different types, in-sleep labs or take-home, that your physician would need to be able to evaluate.
So there's a test I can do at home, in my own home, sleeping.
Yes.
How about that? And what does that test determine?
Well, it determines how many times you stop breathing or have a depressed breathing in every hour throughout the night's sleep.
Okay. And what can happen if I do have sleep apnea? What types of problems will that create?
There are many things that can occur during sleep apnea. I group them into 4 categories. The first one, cardiovascular, high blood pressure, heart failure, arrhythmias. These are all caused by vibrations from snoring, affecting the health of the arteries and creating problems. Cerebrovascular, meaning brain health. Patients with moderate sleep apnea are 3 times more likely to suffer a stroke in their lifetime. Metabolic issues, diabetes due to insulin resistance, increased weight, and other hormone changes can certainly create this issue. And then quality of life issues, increased fatigue, decreased coping skills, inability to create and complete repetitive tasks, irritability, angry spouses, and even problems driving.
That is all great information. When we come back, we're going to dive into this even deeper. And also, Doctor, I'm hoping that you can discuss with our listeners better ways to get a good night's sleep.
Complete Health Dentistry.
Do you snore? Has your spouse told you they have seen you stop breathing while you sleep? Did you know that sleep apnea leads to many medical problems such as heart attack, stroke, diabetes, and even cause death? At Complete Health Dentistry of NEPA, we screen all of our patients for this hidden danger while you sleep. If your screening indicates an airway problem, we can work along with your physician to get you the help you need. If you have already been diagnosed with sleep apnea and can't or are unable to wear your CPAP, Dr. Rogers can help as well. Don't go another night without this life-saving help. Call Dr. Rogers at 253-5000 to schedule your appointment.
Complete Health Dentistry. Transforming your health for a lifetime.
Welcome back to Complete Health with Dr. Mike Rogers. Dr. Rogers, before the break, you explained what sleep apnea is. What if our listeners feel they have sleep apnea?
Well, treatments range from surgery, a CPAP, which is a continuous positive airway pressure machine that people...
That's the mask that you wear, right? To
well,
bed?
I don't wear one, but yes,
Right.
that people would wear to pump oxygen in, and it bypasses or puts so much pressure on it, that's the positive airway pressure, so that it forces the air into the lungs. So people have to get oxygen in. And that is pretty much 100% effective. That is the gold standard of that.
As long as you wear it.
As long as you wear it. And if you can get comfortable with it. I've got so many patients that say, you know what, I have this thing, I just don't wear it because it's uncomfortable. I'm tethered to this machine, and my wife or my spouse hates me wearing it, and you hear it all night long pumping air. The other one, and my personal favorite, is we call them oats, or MADs, M-A-D. So O-A-T or M-A-D. What an oat is an oral appliance therapy, or a MAD is a mandibular advancement device. And
mandibular meaning it goes on your bottom teeth, correct? Lower jaw?
Yes, it goes on the bottom and the top teeth, actually.
Okay.
And so, but it's causing your jaw to be pulled forward. And what that does, just like in CPR, where there's a technique that if there's a suspected neck injury, it's called a jaw thrust. You actually pull the jaw forward to open the victim's airway. And so what this appliance does, is you put a piece in on the top of the mouth, you put a piece on the top teeth, you put a piece in on the bottom teeth, and what it does is you actually adjust that to the point where all your symptoms start to be eliminated. And then we recommend afterwards that you go for another sleep test to corroborate where we've got you, to make sure you're in a good spot and you're oxygenating well.
Okay, so the CPAP you said is basically, as long as you wear it, it's 100% effective. And that's the number one go-to method. So what if I can't wear the CPAP? What would my other option be?
It would be that mandibular advancement device, or the OAT, the oral appliance that we would make. And what that does, that we make them in our office. We take molds, we develop them up, and we actually work with the patient they would wear this appliance while they sleep. It's not uncomfortable, and you're not tethered to anything, but what it does, it advances or pulls your jaw forward to open your airway. It helps eliminate or decrease or eliminate the snoring, and it opens the airway just like in rescue breathing for CPR. It opens an airway. When we breathe through our mouth, that's a pathologic condition, as we talk about. The other thing is, that's an emergency condition when we breathe through our mouth. It's not a normal physiologic. Our normal physiologic breathing is through our nose.
So how effective is that?
It's very effective for people with mild to moderate sleep apnea, so 5 to 15, and even 15s to 30s on the AHI scale. We can make these appliances and have a very effective result with it that you wouldn't need a CPAP. So it's something you'd have to talk to your physician to see if they'd be willing to have you have an oral appliance made. The other is, we have made them for people with severe sleep apnea, and it does help. I'd rather see someone who is not going to wear or never going to wear a CPAP, and it just sits there collecting dust. It'd be better to get them partially oxygenated wearing an appliance. It's not ideal, but it's better. The other thing is, one of the complaints with CPAP is the oxygen, or the pump is pumping so much oxygen to get it into their lungs, that having a combination, a CPAP and an oral appliance, can actually decrease or minimize how much oxygen has to be pumped, because it helps open the airway. So also using it in combination with a CPAP is also an option as well.
So we're almost out of time, Dr. Rogers. Are there any things that we can do, or our listeners can do now, to help get a better night's sleep, even if you don't have sleep apnea but have trouble sleeping?
Yes, there are. It's a process called sleep hygiene, and there's things you can do before you go to sleep or during sleep. One, prior to sleep, is drinking liquids too close to bedtime.
So don't drink liquids.
Correct. Lack of exercise. These are all problems, and it can increase. Lack of sunlight. It affects the melatonin production. Medications and nicotine can create problems. Technology in our bedrooms, TV and iPads can throw off our circadian rhythms and fool our brain into thinking it's daytime or having overstimulated.
That would include cell phones too, wouldn't it?
Yep, cell phones are a big issue. And once again, cell phones themselves, because if they're on all night and they're close to you, they're receiving and sending information 24 hours a day. And our bodies can pick up on that. And so if they're within closer than 8 to 10 feet away from your head, it can affect your sleep. Napping during the day can affect your sleep. Caffeine, alcohol may help you fall asleep. People go, oh, I fall asleep better but you're not going into the proper depth of sleep, the REM, the non-REM sleeps that you're supposed to be. Big or spicy meals too close to bedtime, your body diverts blood to your digestive system, and it affects how your body can sleep. It can't sleep as effectively while it's doing all that other work. Eating in bed, our bodies then become used to or accustomed to this is what bed is for, as a dinner table. During sleep, pets in the bed, with the interruptions that they create, can affect your sleep. Ambient noises, meaning noises from outside the house or inside the house, can affect your sleep. Snoring of your bed partner. Ambient light, meaning your room should actually be as dark as possible, because any light in the room can actually affect how our body reacts to sleep daytime and nighttime. And if the bedroom is too warm, ideally, it's 68 degrees or less. Stress and anxiety medications can affect your sleep. Cell phones, as we talked about, children interrupting your sleep, allergies, uncomfortable mattress, all of these things can affect how we sleep. And those are things that we can change ourselves. The bedroom should be kept for two things only. 1, sleep, and 2, to spend quality time with your significant other. All these other things should be left out of the bedroom and kept away if you want to get a good night's sleep.
Thank you, Dr. Rogers. This was great information.
And now the moment we've been waiting for.
I'm Adam Owens, and it gives me a great deal of pleasure this morning to introduce you to the winner of the New Year Healthy You Transformation Contest, Christine Lewis from Cherry Ridge, Pennsylvania. Good morning and congratulations.
Good morning, Adam, and thank you.
We're so proud of you and so thrilled that you've won this contest, and the work starts now, right?
Yes, it does.
So just the other night, you and several other contestants gathered at Complete Health Dentistry of Northeast PA, and you met with all the sponsors of this event. Can you tell me what that process was like?
It was really interesting. You got to learn what each sponsor does and what they're going to provide to help you get healthy again.
And your entrance at this contest was sort of, what moved you to enter this?
Well, we had heard about it, and we thought it'd really be a good idea, and a couple of my friends pushed me, and mentally I'm really healthy. Now physically I want to match.
I think that's a great effort and a great idea, and now you have a whole team of professionals working with you. Of all the sponsors that you talked with last night, did any of them tell you something that you weren't expecting, or is there anything that you weren't quite prepared for, but now you're going to be diving into?
Most of it I kind of researched myself, so I kind of knew what they provided. Lynn's Healing Zone was really a new one for me, learning about light health and how they use the light to help you heal and rejuvenate your cells.
Yeah. Now, this process it's a 6-month process. Is that right?
Yes.
And you'll be working with this whole team of professionals through this. This is not just sort of set it and forget it. You're deeply involved in this now.
It's going to be really busy, but it's good.
It's quite a commitment, but the other end of the tunnel is a wonder. It's a wonderful thing to come into, right?
Yes, it is.
And now, but after the 6 months is up, are you done? What happens next for you?
No, you got to stick with it. That's the best thing to do. You want to stay healthy. I have a grandbaby coming. I make sure I can keep up with them.
I was just going to ask you, are there people in your life who sort of, you said you had some friends that push you into this.
Oh, definitely. I wish they were joining me, of course, but
you can teach them all the things you learn.
Definitely.
Very cool. Very cool. Well, Christine Lewis from Cherry Ridge, the winner of the New Year Healthy You Transformation Contest. We met just the other night, and it was wonderful to meet you and kind of get to hear a little bit of your story. And we're really excited to check in with you, over the next 6 months and maybe even beyond as you go through this process. Are you excited? Are you nervous?
A little bit of both.
Okay, good. Well, that's good. I think you've got a lot of energy to put into this, clearly, and I like what you said. Your head's in great shape. Now just get the rest of it lined up.
Yep.
Well, thanks for joining us this morning, Christine.
Hey, thank you.